If you're pregnant, chances are you've heard the word preeclampsia. And you know it can sound pretty intimidating. But I promise, understanding it is one of the most empowering things you can do for your health and for your baby. So in this explainer, we're going to break down exactly what it is, what to look for, and how you and your doctor can be proactive together.
So, just how common is this? Well, preeclampsia affects somewhere between 2 and 8% of all pregnancies around the world. It's actually one of the main high blood pressure disorders in pregnancy, and that's exactly why being informed is so critical.
All right, let's start with a really clear definition. Preeclampsia is a serious blood pressure condition that shows up after the 20-week mark, so in the second half of your pregnancy. And here's the key. It's not just about high blood pressure. What really defines it is that it also shows signs that it's affecting other organs, like your kidneys or your liver.
We've laid this out to answer all of your big questions. First, what exactly is it? Then we'll get into assessing your personal risk factors. We'll cover the crucial warning signs you need to watch for, talk about prevention and management, and finally, what care looks like after your baby arrives.
Okay, let's dive right into our first section. How do doctors actually make a clinical diagnosis of preeclampsia? Diagnosis isn't based on just one single thing. It really starts with sustained high blood pressure. We're talking a reading of 140/90 or higher on at least 2 separate occasions. But, and this is important, that's only part of the story. Doctors also have to find at least one other sign that your body's under stress, like seeing protein in your urine, having a low platelet count, or issues with your liver or kidney function.
So, this all leads to a really crucial question. Could this happen to you? And it's important to know, a lot of cases happen in perfectly healthy first-time pregnancies with no obvious risk factors. But there are certain things that can increase your chances.
This table breaks down risk factors straight from the guidelines of the American College of Obstetricians and Gynecologists. Notice there are 2 levels here. If you have just one factor from that high-risk list, like you've had preeclampsia before, or you have chronic high blood pressure, your doctor might talk about prevention. And the same thing applies if you have more than one of the moderate risk factors, like say it's your first baby and you're also over 35.
All right, this brings us to what I think is the most actionable part of this whole explainer, the warning signs. Knowing these symptoms is how you become your own best advocate. It's so important.
The biggest takeaway here is to never just dismiss these symptoms. Some swelling in your feet could be normal, but sudden swelling in your face or hands, that's a red flag. A really bad headache that just won't quit, changes in your vision, or a sharp pain up in your abdomen, those are all reasons to call your doctor or midwife right away. Don't wait.
It's also really helpful to know that doctors classify the condition based on how severe it is. As you can see, the main difference with what they call severe features is much higher blood pressure, 160/110 or higher, or more significant signs of organ damage. This distinction is absolutely critical because it directly changes the treatment plan and how urgently a delivery might be needed.
Okay, so knowing the risks and the symptoms is one thing, but what can we actually do about it? Let's get into the action plan.
This is the big question, isn't it? When you hear about all these risks, the first thing you want to know is there anything I can do to stop this from happening?
And thankfully, the answer really does provide a lot of hope. For women who are identified as being at high or moderate risk, there is a clear, evidence-based step that can significantly reduce the chances of developing preeclampsia.
For those who fit the risk criteria we just talked about, guidelines recommend a pretty simple proactive step, a daily low-dose aspirin. As you can see here, this usually means starting an 81 milligram dose, that's just a baby aspirin, sometime between 12 and 28 weeks, and then you just keep taking it until you deliver. This one step has been shown to really lower the risk, but of course, this is a conversation you have to have with your own doctor.
Now, if you're diagnosed, your care team is going to start a very clear protocol. It means much closer monitoring for both you and your baby, medications to get your blood pressure under control, and in severe cases, magnesium sulfate to prevent seizures. But it is essential to understand that all of these are ways to manage the condition. The only actual cure for preeclampsia is delivering the baby and the placenta.
And the story doesn't just end with delivery. The care you receive after birth is a huge part of managing preeclampsia and protecting your health down the road. The risk doesn't just vanish the second your baby is born. And that's why everyone with preeclampsia needs really close monitoring of their vitals for at least 48 hours after delivery. This is just to make sure your body is recovering and your blood pressure is headed back down to a safe level.
And if you're already thinking about future pregnancies, it's really important to understand your risk of it happening again. As this chart shows, if you had preeclampsia once, you have about a 1 in 7 chance of it recurring. But look at this. That risk more than doubles to about 1 in 3 if your case was severe enough that you had to deliver before 34 weeks. And this brings us to a really crucial point about your long-term health. We now know that a history of preeclampsia is a risk factor for cardiovascular disease later in life. But listen, that knowledge is power. It means that focusing on a heart-healthy lifestyle, through diet, exercise, not smoking, it becomes even more important for protecting your health for years and years to come.
And I want you to know that everything we've talked about today, from figuring out your risk to prevention to management, it's all backed by leading medical organizations like the American College of Obstetricians and Gynecologists. These are not just suggestions. These are evidence-based guidelines designed to get the safest outcomes for you and your baby.
We really hope this has armed you with the information you need to feel more confident and prepared. The goal here isn't to cause worry, not at all. It's to encourage awareness and to help you start a proactive conversation. So take a second to think about what we've covered. What is the one question you're going to ask your doctor at your next visit?